اتفضل.
express my deepest gratitude to the Professor Muhammad Fadil for his wonderful organization of this course and the organizing committee. I'm going to speak about a different subject this afternoon as regard managing diabetic foot. We are, as surgeons, consider always operative interference. So when we first confronted with such cases like diabetic foot ulcers and diabetic foot in general, we think about how to operate on these patients. But there are other lines of treatment we can try before embarking to surgery. From one of these lines of treatment, hyperbaric oxygen therapy in treatment of club foot. Hyperbaric oxygen is respiration, is inspiring oxygen under pressure, pure oxygen under pressure. At higher pressure, the body can absorb up to 16 times more oxygen, which benefits every one of the 15 trillion cells in the body. We can live our life inspiring only 20% oxygen in the normal air and under regular pressure. So, and the body can work full function from this percentage. So if we increase the percentage of oxygen and pressurize it, definitely the function will improve markedly. Hyperbaric oxygen therapy is not a new method of treatment. It has been used since the 70s of the last centuries in treatment of the well-known decompression sickness, which affects scuba divers and deep sea divers who need to go back to surface rapidly, so the nitrogen in the blood changes into bubbles, and they need that hyperbaric oxygen as life-saving for them. The patient breathes about 95% of pure oxygen, not 20 as in normal air, and that oxygen is pressurized to about 1.5 bar. And this is how the hyperbaric oxygen chamber looks like. We have two types of hyperbaric oxygen. We can see here this is a single patient chamber, and this single patient chamber can be used for only one patient at a time, and we can see here it's made of glass or transparent material, and the patient can watch TV, and there are speakers inside and can communicate to outside through the telephone, so it's very comfortable and not annoying. And this chamber, larger chamber, is for many patients, and we have to inform the patient, because when we discuss the hyperbaric oxygen therapy, these patients, they think that they are going to have wound dressing under pressurized oxygen, which is not the situation at all. The patient just relaxes, sitting, doing nothing, watching TV or going through his mobile and breathing the hyperbaric oxygen. So the oxygen goes to the diseased area from inside the body, not from outside. How the hyperbaric oxygen works, how it helps sorting out the diabetic foot ulcer problem. Number one, it reduces the inflammation and swelling, because it goes and edema or the edematous fluid around cells prevent the nourishment of the cells properly, and the inflammatory reaction also prevents the healing of tissue, especially if the inflammation is chronic. So hyperbaric oxygen or oxygen under high tension reduces the inflammation and swelling to help the healing. Having an oxygen in high pressure inside the blood stimulate angiogenesis, and this is very important. By this stimulation, it improved the angiogenesis, improves the blood flow to the diseased area, because in ulcers, we know the ulcer wall is always sclerotic and the fibrotic, and there is no enough blood reaching the ulcer or the floor of the ulcer itself. So angiogenesis and improves the blood flow and get more blood to the diseased area. It also induces or increases collagen synthesis and formation of new granulation tissue. And both these factors are very important for ulcer and wound healing. And with high pressure or high tension of oxygen in blood, it stimulates leukocytic function, and this is combat organisms and control infection. So hyperbaric oxygen therapy significantly increases complete healing and increases the rate of healing. So the ulcers heals in very short time compared to regular healing time without the hyperbaric oxygen. It also, the good results from hyperbaric oxygen, that it reduces the risk of major amputation by 40 to 50%. And we mean by major amputations is below knee amputation or even above knee amputation. And not only major amputations risk has been reduced by hyperbaric oxygen, also toes amputation also reduced markedly by hyperbaric oxygen therapy. It is a safe method and can apply to a large number of patients together, as we could see, and contraindications and minimal. The protocol of hyperbaric oxygen, there are a lot of protocols, and they are all set for each condition. So in hyperbaric centers, they have their own, every hyperbaric center have their own protocol, but they all goes around that fixed numbers, 8 to 10 weeks. We have to inform the patient it will take 8 to 10 weeks. He has to arrange that during all the course of treatment. 8 to 10 weeks of treatment, about 40 sessions. And it's not every day, but it's 4 to 5 weeks a day. Sorry, 4 to 5 days a week. He has make arrangement that every week has to go at least 4 times to the hyperbaric center, and each session takes about 60 to 90 minutes. Can the patient go directly to the hyperbaric oxygen therapy? No, he must be arranged for that. We have to make arrangements. We have to have a good history and physical examination for the patient in order not to have a respiratory problem or any history of ear problem, lung problem. So we must know that he's free from these aspects. Chest X-ray is very important. Ear examination to clear the sinus, to get sure that nasal sinuses are not chronically inflamed or obstructed. And in some cases where there is spinal deformity or kyphosis, we need to have a respiratory function test in order to get sure that the patient can accept or receive this line of treatment safely. Other investigations, like according to any special case the patient have, ECG for example, kidney functions, liver functions, although they are not contraindications for treatment. Side effects of hyperbaric oxygen therapy is middle ear barotrauma. This is the most popular problem which can happen. It only happens to less than 40% of cases, but 40% is not small percentage, but we have to anticipate that and inform the patient to report that if he has any problem with his ears as soon as he develops it. Vision changes, myopia due to swelling of the intraocular lens because of the lens gets swollen due to oxygen, and that causes myopia, but this problem is transient and disappears when we finish that course of treatment. Sinus pain, when the sinuses are obstructed, it causes severe sharp pain, but it's just symptom and no problem. It can be treated symptomatically and successfully, of course, will cause no problems. Oxygen toxicity is a very rare problem. Patient, they may develop seizures or chest pain and breathing difficulties, but and then we have to stop the treatment course immediately. Many patients have claustrophobia and they can stay in closed areas. They can tolerate the multi-patient chambers. And that's why, as you have seen, the single patient chamber is always transparent, so the patient can feel that he is in closed area. And there are much less common side effects like fatigue, weakness, and changes in blood sugar in diabetic cases. And all of these are less common and less interfering with the line of treatment. What are the contraindications of hyperbaric oxygen therapy? Of course, if the patient has history of pneumothorax, because we are pushing the oxygen in higher pressure, we have to rule out this problem at all. No history or any suspicion of pneumothorax, no history of any chest, ear or sinus surgery. We have to get sure that the sinuses are clear and there is no infection in them. All these things can be sorted out, treated prior we start the course of therapy. High fever and certain blood disorder like congenital spherocytosis. Another contraindications, convulsive disorders, claustrophobia, as we have mentioned before, middle ear infection, pregnancy. Pregnancy is not an absolute contraindication. We can apply that line of treatment in some cases of pregnancy when indicated, of course, but with very cautiously. Patients who have nicotine addiction because they have withdrawal manifestations, and emphysema, of course, is one of the most important contraindication of hyperbaric oxygen therapy. But what about malignancies? We may consider as it is induce in angiogenesis and improve the cells biology, that it is contraindicated in malignancies, but all the researches has confirmed that it is not contraindicated in malignancies. And even it is adjunct treatment in malignancies, and complications of chemotherapy and complications of radiotherapy can be treated effectively and successfully by hyperbaric oxygen therapy. So we can consider hyperbaric oxygen therapy is a very important line of treatment. It is not so expensive as repeated surgeries. It is safe, minimal side effects, and applicable, and improves the health of the diabetic patient altogether, and of course helps very well in treatment of diabetic ulcers. Thank you, and thank you again for the organizing committee and Professor Muhammad Fadel for this invitation.